Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Well, according to data from the National Institutes of Health, only half of adolescents with depression get diagnosed before they reach adulthood. And as many as 2 in 3 depressed teenagers don't get the treatment that could help them.
Wow. In an effort to diagnose depression in teens earlier, the American Academy of Pediatrics recently issued updated guidelines that call for universal screening for depression. The guidelines call for the screening at least once a year for adolescents aged 12 and up. Here to discuss is Mayo Clinic pediatrician Dr. Janna Gewirtz O'Brien. Welcome to the program. It's nice to meet you.
Nice to meet you too. Thank you for having me.
Dr. Gewirtz O'Brien?
Yes.
Great to have you on the program. So the new screening guidelines, I looked at this and I said, you know, that sounds good, but it doesn't seem practical. I mean, kids 12 and up at least once per year. I mean, how many kids between 12 and 20 or 19 go to the doctor once a year?
So that's a great question. And that's one of the biggest points of discussion about this document is how are we going to do this in a practical way? The good news is here at Mayo, we have already started to implement some of this, and we've been able to do it and able to implement it. We have great support from our infrastructure here and administrative support to be able to do this from the nursing side, from the doctor side. But yes, it does involve a concerted effort from multiple members of a team, and it involves a team approach.
How do you screen a teenager? What do you do when they come in for their appointment?
So good question. So there are a lot of different ways that we screen teenagers. First of all, we start off by talking with them. But this recommendation specifically recommends the use of a standardized screening guideline. So it involves a questionnaire of sorts that can be done electronically. It can also be done on paper. Right now, often the way that it works in our offices is that an adolescent will actually be handed the piece of paper during the rooming process, and by the time they've gotten in the room with me, they've already usually completed it.
And do you have the results? Do you have
It's a fairly easy test to score, so I'm able to look at it and I have the results within seconds.
And then you say you talk to the teenager. How long does that normally take? I mean, let's say, so they're coming in for a routine exam,
Yeah.
right? And you think as part of that exam, in addition to this test, you need to talk to them. Mm-hmm. And what do you talk to them about? How do you know if there might be depression?
Well, we talk to all adolescents during a well-child visit. Well-child visits, to get back to that question initially too, well-child visits for adolescents usually occur every year to every other year. So we are trying to see them. Some don't come in, and we understand that,
Sure.
but we're going to try our best. There's always a conversation that's a part of that. Usually we try and have some of that conversation with the parent there, and part of that conversation actually in private. There are certain kids that I might be more likely to talk about this more and delve into, and that might be a longer conversation. Kids that would be considered in the high-risk category. So kids with young people with a strong family history of depression, someone who's had a depressive episode in the past, someone who's there complaining of fatigue or difficulty with sleeping. Those might be subtle signs of depression. Other things that might be signs would be difficulty with performing in school or drop in the grades, which is kind of a common sign for adolescents.
Aren't all of these, though, common signs for adolescents? I mean, where do you say, well, this is being a teenager, and this is, you've got some depression or anxiety we need to work through?
And we're asked that question a lot, actually, by parents to say, well, how do I know that this is a teenager being a moody, quote, moody teenager versus a real medical
Right.
issue that's
Yeah.
depression?
Exactly.
And the answer is really about the severity of symptoms, the number of symptoms of depression that are present, and the way that it impacts their life. So from my perspective, when it becomes time to act on it is when it starts to impact their school function, impact the clubs that they used to enjoy and now they're no longer enjoying them. When a kid who previously loved participating in swim or gymnastics or ice skating comes back and they say, I really don't like these things anymore. And in fact, I'd rather just sit in my room and sleep. Those are signs that we're having a problem. The young people I see with depression, and there's a lot of them, their lives are being impacted in an everyday in a big way.
You know, it's sort of strange to hear you talk about this. And because when I was a kid growing up, I don't ever remember anybody even talking about a kid with depression. And now it seems like every parent has a child with depression. I mean, what's the difference? What has changed?
So there's a few things. First of all, we have had increasing awareness about mental health issues in the community, and that's a great thing. There's still a lot of stigma around mental health, so there's still a lot of judgment that comes with this, or perceptions of, I've heard people say laziness, or that it's their fault in some way. None of that is actually true. This is something that's part of the brain chemistry that becomes messed up in some ways. I mean, it really becomes problematic. It's young people I see with depression, it's like they're seeing the world through dark-colored glasses. And our job as pediatricians and as people who work with young people who have depression is to help them be able to see things the way that they are and be able to enjoy their lives to the fullest.
So I was just going to say for Dr. Shives and for myself, so when we were teenagers, there really wasn't a counselor or there wasn't services available to help us if we found ourselves in these positions. So we didn't even think about it.
Yeah.
We didn't even think about maybe this is the reason why I'm not enjoying what I used to enjoy.
Yeah. So there's actually been mixed, when we look at this kind of statistics and the prevalence of depression over time, there's actually mixed reviews. Some of the studies say that there has been a slow and steady increase in major depressive episodes among adolescents, but there are others that say, it hasn't changed that much from the 1960s to the 1990s when they've done kind of retrospective studies. So it actually is mixed. It's not totally clear whether or not the rates have been increasing or whether or not there's increased awareness. Nonetheless, nowadays we actually do have some really great ways of treating depression, and we have increased awareness that depression exists. So people are, I think, a little bit more willing to talk about it in some circles, but not always.
We talk about it at my house with our teenagers that, your brain is developing and you are becoming aware of your mental health. So that's something that we didn't ever talk about when we were kids. But what is the first thing that you can tell a kid that is becoming aware of their mental health to put them at ease, or how can you help them?
Tell them to put their phone away, but the first thing to tell.
Well, that is important too. The first message I convey when I meet a young person who is concerned that they're depressed, or when I meet a parent, is that there's actually a lot of hope. There's treatment. We have shown that we can effectively manage depression. So young people who are depressed, we're able to plug them in with therapy. In some cases, we're able to use medications, and we can dramatically improve their outcomes, their ability to enjoy their lives, and we're able to get them back to school, back to work if they work, or back to their activities that they like to do.
So do you go the skills versus pills route first?
It depends on the situation. We always talk about the importance of the community and the family, and we talk about the role of therapy in almost every single case of depression. But there are some cases, in more severe cases, when medication is important too, even from the outset.
Historically, the medications, and I could be wrong about this, but the medications for the treatment of depression have never been great. Or do you have some better ones now than there were a decade ago?
So the selective serotonin reuptake inhibitors, or SSRIs, those are like Prozac or Lexapro, fluoxetine. Those are kind of their names, there's brand names, and are a very well-studied class of medication in adolescents. And now, over the past several decades, we've actually been able to show that they're effective and that they work. They're not without side effects. As with any medication, we always discuss the risks and the benefits with any person, both the adolescent and with the parent. But yeah, I'd say now we have medications that work and we have therapies that work. So we know that if you're an adolescent listening to this who is worried that they're depressed, or if you're a parent who's worried that your adolescent might be depressed, there are things we can do to help.
Oh, perfect. That's good to hear, because it's such a common problem.
It is.
All right. Screening for teenage depression with pediatrician Dr. Janna Gewirtz O'Brien. Thanks so much for being with us.
Thank you for having me.